with Mr. Rick. Do you mind introducing yourself to everyone?
Hi, my name is Rick Hubbard, and I'm Executive Vice President of Professional Relations for Cero Mental Health.
Very good. And can you tell us a little bit about what we have experienced this weekend?
So we are at the 12th Annual DFW Behavioral Health Symposium in Irving, Texas. This conference is a product of the Dallas chapter of the Texas Association of Addiction Professionals and the Fort Worth chapter of the Texas Association of Addiction Professionals annual fundraising. And so the proceeds from this conference help to support new therapists who are seeking to enter the field with scholarships and other areas of support that they might need. The conference also helps the chapters to fund their advocacy efforts at the state and national level.
Very good. And how long has this conference been going on? And then how long have you been involved in it?
So I am one of the co-founders of this conference, and that we are in our 12th year.
Wow.
Doing this conference here at the DFW Airport Sheraton Hotel.
Very good. Well, I appreciate your time today, Mr. Rick Hubbard, and we look to hear more from you in the future.
All right, thank you very much.
Thank you. Hey, Marketha, how are you?
Hey, Bernitha, how are you?
So good. Can you tell me, Marketha, about everything you do in here and your role in this symposium?
So this symposium is for the Fullbrook and the Dallas TAPP. So I'm the president of the Dallas TAPP, which is the Texas Association of Addiction Professionals. And so my role, I'm on the speaking committee. I help to get speakers for this event. I run the registration booth. So I have a team of volunteers that help me, and they've been amazing for me with that. And then some of the entertainment, I've been able to provide.
Yeah, that DJ was live the other night, so we had a good time. My team has reset and all that. So tell me where you can go online if you want to volunteer or maybe have a episode. Is it, okay, DFW Behavioral Health Symposium,
Yes.
Okay. We can go at that time. I don't see what you, okay, yes. We don't have a,
Yeah.
okay, so we can go to DFW Behavioral Health Symposium.com to find out more. Also, yes, and there's also a YouTube channel as well, which is DFW Behavioral Health Symposium, and that is on YouTube as well, where you'll find these videos and many, many more important tidbits. So thank you so much, Marketha.
All right, thank you.
Appreciate you.
All right.
About what brings you to the symposium?
Great. My name is Gerald Carter. I am from Connections Wellness Group.
Okay.
We have 12 facilities across the Metroplex, and we are here to support the DFW Behavioral Health Symposium to be able to offer our resources to the community and to let them know we're here to serve.
Very good. And where can we go to find out more about your organization?
Great. You can go to connectionswellnessgroup.com.
Very good. Thank you so much.
Thank you. Yes,
Pleasure.
ma'am.
Bye-bye. All right. Let me hand you. Hi, I'm Bernitha. Hi, Jennifer. Nice to meet you. I'm going to do this, Jennifer. Can you tell me a little bit about your table and what you have going on here?
So we are a positive recovery center. So we are a substance use treatment center for adults 18 and up. We have 22 locations throughout the state of Texas. We offer full continuum of care, detox all the way to outpatient services and sober living for men and women. We're insurance friendly.
Very good. And where can we go to find out more about your organization?
So you can find us at positiverecovery.com or come visit us at the table.
Okay. Thank you so much. I appreciate you. Have a great day. Yeah, you're great. Hi, I'm Bernitha.
Hey, Nick Ferris. Nice to meet
So
you.
nice to meet you. James, nice to meet you. Can you tell me a little bit about your booth here, what you have going on, and what services you offer?
Yes, ma'am. Of course. So we both work with Millennium Health. We're
Okay.
a nationwide specialty drug testing laboratory.
Okay.
So essentially what that means is we're a specialist in the behavioral health and addiction world and space.
Okay.
So that means our testing, our test menu, results, even the clinical data and education we provide clients is just really geared towards those, I guess, those facilities and clients and clinicians within those organizations.
Okay. And so people can reach out to your company, clinicians, and they can get their patients tested to see sort of if there's any chemicals in their bloodstream, if they've been using any.
Yes, yeah, we test via urine or saliva drug
Okay.
testing, and they can test for any medications they're prescribing, as well as test for all those crazy illicit street drugs that are out there too.
Okay.
Like 8 different fentanyl analogs, kratom, bath salt, spice, xylazine, if you've heard of that.
I don't know any of this stuff.
Oh, okay. Well, it's just something crazy. People are cutting into fentanyl these days.
Oh, wow.
Yeah.
Okay. And so where can we go to find out more about your organization?
MillenniumHealth.com.
MillenniumHealth.com.
Or contact your local reps. We're in all 50 states.
Okay.
So, but yeah, MillenniumHealth.com is the best way to go about it if you don't have contact with a local person.
Okay. Thank you so
Yes,
much.
ma'am. Yeah.
Appreciate your time.
Of course.
Thank you. You too. Thank you so much. Great job. Incredible. Appreciate you. I do. Hi, I'm Bernitha.
Bernitha? Bernitha.
Yes.
Can you hear me?
I can hear you great.
I'm Eric Button. I'm with the Fullbrook Center.
Okay, tell me about the Fullbrook Center.
So the Fullbrook Center's been around for 6 years.
Okay.
It's family owned
Okay.
by Jessica and her husband Josh Slay.
Okay.
And it's a women's center who help women recover from substance use and trauma, which is always intertwined.
Sure.
So they work with complex cases in helping women achieve freedom and independence from their disease.
So is it in-house?
It is residential treatment. They also have intensive outpatient,
Okay.
and they use partners in the Kerrville area. It's in Central Texas, in
Okay.
Fredericksburg.
Okay.
Huge bluebonnet season right now down there.
Oh, yeah.
And they have an intensive outpatient, which would be continuing care for the women when they leave residential treatment into the Kerrville or Central Texas area. And then there's sober home partners that they work with. Yeah.
Where can we go to find out more? I'm going to push this up a little bit closer to
So what you can do
Okay.
is you go to www.fullbrookcenter.com, or most importantly, you call Cynthia
Okay.
Jeffrey. And let me tell you her phone number. Give me that card.
Sure.
You dial 817-994-6365 and you ask for Cynthia, the Fullbrook Center.
Okay. Thank you so much. I appreciate you, Eric.
Yeah. Thank you.
Thank you. Great job. You did great. It was. And listen, you guys can Google me. You can go online and see your videos, okay? Thank you. And actually, let me take one of these cards.
Oh, yeah, take Cynthia.
The email. Okay. Oh, you're Cynthia. Okay. Hi, I'm Bernitha.
I'm David, Master.
So nice to meet you, David.
Nice
Can
to
you
meet
tell
you
me
too.
a little bit, thank you, about your organization and what you're doing here today at the symposium?
So the Haven Detox, we do medical stabilization.
Okay.
So what we do is we help get people stabilized from drugs and alcohol.
Okay.
The really great thing that we do is we provide transportation
Okay.
to and from our facility.
Mhm.
We work with a lot of different facilities all over in this room. So what we do really well is we help get patients stabilized so that way they can make it to residential treatment. So we only do 5 days typically for detox. If someone comes in with an aftercare plan, we make sure we honor that aftercare plan.
Okay.
But if someone comes in and they don't know what to do next, that's where we partner with all these beautiful programs that are in this room, and we utilize them because if someone comes into the Haven, they typically need more than just 5 days. They need residential treatment preferably, but we know that that's not always possible. So we just try to be as resource connected as possible. So.
Okay. And so if someone's coming in and they've been, maybe using alcohol or drugs for years.
Yes.
Right?
Uh-huh.
And so their body's in a state of.
Oh, yeah.
So you guys help them safely because we know, or
yes.
I've learned this week,
Yes.
that can be really dangerous. Like, say, for example, someone coming off of alcohol for years, that could be really dangerous if they just tried to detox on their own.
Absolutely, yeah.
Okay.
Yes, it is. It can be very, very dangerous.
Okay.
So we make sure that they get that they come off of alcohol safely, and the really great thing is we're hospital based, so we can take really acute patients. So if someone is like in liver failure or they have kidney failure, we can still take them. If someone's on dialysis, we can take them. We have dialysis within one of our within our hospitals. So it's a really great way to get people who have a lot of barriers to care to remove them. So we just, that's what we strive to do, is we try to get people to break the addiction cycle. And we just love on the patients while they're with us, and I love what I do.
Yeah, so, and you're doing it safely.
Yes.
We know that if we put our family members in your hands, they're going to to be safe because it's 100%. Medical-based 100%. Facility.
And not just the like the medical portion of it. It's the care, the care that the passion that we put into it. We're very intentional about who we hire.
Okay.
Because if I'm in recovery. And I used to hate going to the hospital because I would go there and I would just be treated less than, and it's just people who are in their active addiction, they can be very abrasive. They're very standoffish.
Okay.
And then it causes other people to be like rubbed the wrong way. So which I totally get. But the great thing about our staff is we just love on them.
Because do you have people who have been
there? Yeah. So a lot of our staff are in recovery. So it just gives us that ability to break that barrier and empathize and relate. So which is a huge key. So but like I said, we are very intentional about who we hire. And if you don't treat our patients well, you're not going to be at the Haven for very long. So I'm very passionate about what we do, and the Haven's home. So
love it. Where can we go to find out more about the Haven home?
So you can reach out to me directly, or you can go to our website at thehaventx.com.
Okay.
But we do admissions 24 hours a day. We have a phenomenal admissions director. His name is John Chapman.
Okay.
And we do admissions literally 24 days, 24 hours, 7 days a week, 365 days a year.
Okay, so, and it looks like the admission number is 888-219-6895.
That's it.
And you can call that number 24/7 and get help.
Yes.
Thank you so much.
Absolutely.
I appreciate you.
It was very
Have a
nice
great day.
to meet you.
You too. Great job.